Dear students, in this module we will try to examine the fertility influencing policies. This is as part of the population policies and programs. Through this module, we will examine the global fertility trends. We will also have a look at the fertility trends by different regions. Then we will talk about replacement fertility and then move to the fertility projections at the global level and at the regional level. Then we will talk about measures adopted to raise or reduce the fertility levels. Then we move to the policies to address fertility in general, and then the policies to address adolescent fertility. Finally, we will summarize the learning outcomes of this module. Let us start with global fertility trends. Globally, the total fertility declined from 4.4 children per woman in 1970-75 to 2.5 children per woman in 2010-2015. Among all the countries with at least 90,000 population in 2013, number of countries with total fertility of 4 children per woman or more has declined from 135 during 70-75 to 45 during 2010-2015. Substantial decline in the fertility level in many of the countries. If we look at the fertility trends by region, the fertility levels and trends vary widely across the different regions as well as countries. For instance, the lowest fertility was recorded in Europe with the total fertility rate of 1.6 children per woman. This was during 2010-2015. If we look at the corresponding figure for rest of the countries or regions rather, it was 1.9 in case of Northern America and 2.2 in Asia and Latin America and the Caribbean, and the figure was 2.4 in Oceania and 4.7 in case of Africa. The highest fertility was recorded in Africa. Another important concept related to fertility is the replacement fertility. Whether the women are replacing themselves by one child or are they replacing themselves by more than one child, that makes a difference to the population growth of a particular country. The ideal scenario is that a woman gets replaced by one female child. Among 45 countries from the more developed region with at least 90,000 population in 2013, that was the denominator. 41 countries had already attained below replacement fertility or replacement fertility during 1990-1995. All the countries except Albania had reached below replacement or replacement level of fertility by 2005-2010. Let us now look at the fertility trends in more developed region. 36 countries from the more developed regions experienced slight increase in fertility between 2000 and 2005 and 2005 and 2010. Fertility in countries from the more developed regions was on an average at about 1.7 children per woman during 2010-15. On the other hand, in the less developed region, fertility levels continued to decline in majority of the countries. 41 countries from the less developed region reached below replacement or replacement level fertility during 2010-15. In the less developed region, if you take 2010-2015 as a reference period, the total fertility remained high at 4 children per woman or more than 4 in 45 countries. And these countries include 17 countries where total fertility was 5 children or more per woman. Let us now examine the fertility projections. Having observed the trend so far in terms of fertility levels, it is worthwhile to move towards the projections for fertility levels. These projections are given by United Nations. According to these projections, by 2030-2035, only 14 countries will have a total fertility of 4 or more children per woman. Substantial decline in the number of countries with having higher fertility of 4 or more children per woman. Number of countries with total fertility below replacement level of 2.1 children per woman increased substantially from 55 during 1990-95 to 86 during 2010-2015. And the projections indicate that the number of countries with below replacement level of fertility is expected to be 119 by 2030-2035, substantial increase in the number of countries that would have below replacement fertility by 2030-2035. Now, let us try to understand the kind of measures or policy initiatives implemented by various governments so as to reduce the fertility levels. These measures include integrating family planning and safe motherhood programs into primary health care systems, providing access to reproductive health services, promoting responsibility of men in sexual and reproductive health, raising the minimum legal age at marriage, particularly for the girls, improving female education and employment opportunities, discouraging son preference, and providing low cost, safe and effective contraceptive services. On the other hand, we also have information about the policy measures, the program initiatives that were taken by respective countries to enhance the fertility levels. These are the countries with very low levels of fertility, below replacement fertility levels. These countries felt the need to enhance the fertility levels, thereby enhance the population growth. The policy initiatives include baby bonus, family allowance, maternal, paternal and parental leave, subsidized child care, tax incentives, subsidized housing system, subsidized housing schemes, flexible work schedules, so that the parents can take care of the children. Child bearing and child rearing would not be a burden for the parents who are working, particularly the mothers who are working. They should not feel the burden of child bearing and child rearing because of their working status. And campaigns to promote sharing of parenting and household work between the spouses. And then what is the kind of effect of the measures adopted so far? The number of countries, mostly in Europe, adopted these measures, and of these countries, many countries have experienced modest increase in fertility between 2005 and 2005-2010. However, the point to be noted here is that implementation of these measures or initiatives is quite difficult, and ascertaining the effectiveness of these measures in terms of fertility change is also not so easy task. And then let us look at the policy responses to address the fertility scenario with 2013 as the reference time point. 27% of the governments had policies to raise the level of fertility. On the other hand, 43% had policies to reduce the fertility. The remaining 30% of the countries or the governments had policies to maintain the fertility at the current level, or these countries were not intervening to influence the fertility level. And percentage of governments with policies to raise fertility, this increased from 9% in 1976 to 27% in 2013. This is in response to the fertility level prevailing in the respective countries. The percentage of governments with policies to reduce the fertilities, this also increased from 27% to 42% during 76 and 96, and it remained at about 43% in 2013. During this period 1976 to 2013, percentage of governments that did not have policies to influence fertility declined sharply from 52% in 76 to 13% in 2013. Let us look at the policies adopted by the countries and governments from more developed region to enhance fertility levels. In 1976, 1 out of 5 governments from the more developed regions had policies to enhance fertility. By 2013, 2/3 of the countries from more developed regions had policies to enhance the fertility. On the other hand, the policy initiatives to address fertility in the less developed regions provide a contrasting picture. Of course, this is in line with the prevailing fertility scenario in the countries of the region. In the less developed regions, in 1976, half of the governments did not intervene to influence the fertility, and 1/3 had policies to reduce the fertility. By 1996, the situation has changed because of the changes in the fertility and changes in the population growth. 1/4 of the governments in these less developed regions did not intervene to influence fertility, whereas more than half of the governments had policies to reduce fertility. Between 1996 and 2013, percentage of governments in less developed regions that did not intervene to influence fertility declined to 12%. That means more and more governments from the less developed region have started taking measures towards reduction of fertility, but percentage of governments with policies to reduce fertility remained mostly unchanged. In the more developed region, in 1976, only 1 in 5 governments had policies to raise fertility, but by 2013 this moved to more than 2/3. In 1976, half of the governments in less developed region did not intervene to influence fertility, but 1/3 had policies to reduce fertility. This figure 1 tells us about the government's policies to influence the level of fertility between 1976 and 2013. The first panel gives the percentage of governments that had policies to raise the fertility level. This increased from 9% in 1976 to 27% in 2013, threefold increase. The middle panel tells us about the policy response to maintain the fertility level or no intervention at all from the governments. This percentage declined from 1976 to 2013. In 2013, 30% of the governments had policy to maintain the current level of fertility or no intervention at all. The third panel gives the percentage of countries that responded towards reducing the fertility level. This enhanced from 27% to 43% from 1976 to 2013. All these figures are from the United Nations publication dated 2013. Now, let us move to the least developed countries and the kind of policy response from these countries. Since mid 1970s, in the least developed countries, increase in proportion of governments with policies to reduce fertility has increased substantially and significantly rather from 14% to 94% during 1976 and 2013, and decrease in percentage of governments in these region with no policies to influence fertility declined from 79% in 76 to 2% in 2013. Means most of the governments from the least developed area decided to have some policy to influence fertility. Let us now focus on the policy response from the African countries. The 1994 ICPD, International Conference on Population and Development, was a landmark conference in the history of population of the world, and one significant development in population policy post ICPD was in terms of increase in number of governments in Africa that reportedly have policies to reduce fertility. In 1976, 25% of the governments in Africa had policies for reducing fertility, and by 1996 this increased to 68%, and it went up to 74% in 2005 and further got enhanced to 83% in 2013. Substantial increase in the proportion of governments that had policies to reduce fertility in the African region. Let us now look at the policy response from Europe and Asia. In Europe, percentage of governments that had policies to enhance fertility went up from 24% to 73% during 1976 and 2013. On the other hand, in Asia, 40% of the countries continued to have policies to reduce fertility, and percentage of countries that had policies to enhance fertility increased from 5% to 31% during 76 and 2013. Response of the more developed and less developed regions. This kind of comparison is very interesting. In the past 3 to 4 decades, more number of governments in less developed region with relatively high fertility levels have adopted policies to reduce fertility. On the other hand, the governments in more developed regions with ever declining below replacement fertility levels have adopted family friendly policies aimed at enhancing the fertility. Let us have a look at figure 2 that gives details about government's policies so as to influence level of fertility categorized by level of development. Namely, we have the results presented for more developed regions and less developed regions. In case of more developed regions, the percentage of governments with policies to enhance fertility increased from 21% in 1976 to 69% in 2013. On the other hand, in case of less developed regions, the percentage of governments with policies to reduce fertility increased from 34% to 57% during 1976 and 2013. Let us now turn to table 1. It gives the policy response from the governments of various regions during 1976 and 2013 towards fertility levels. The trends are visible. There has been substantial change in the perceptions and policy response of the countries from more developed regions as well as less developed and least developed countries. In case of more developed regions, more and more efforts are initiated towards raising the fertility level. On the other hand, in less developed and least developed countries, more and more efforts are towards reducing the fertility rates. Table 2 gives the same kind of data or information by various regions of the world like Africa, Asia, etc. Now, let us move to adolescent fertility and implications of adolescent fertility, namely the early childbearing, and then the way the early childbearing impacts the lives of the girls and women, or in particular that of the adolescents. Early childbearing is associated with low levels of educational attainment and poverty. It also enhances the risk of maternal death or physical impairment. And children born to young mothers, they tend to have higher levels of morbidity as well as mortality. In view of the implications of early childbearing or adolescent fertility, many governments have expressed their concern about the higher levels of adolescent fertility in their respective countries. Let us look at figure 3. Here we are talking about the governments considering level of adolescent fertility in their country as a major concern, and then the countries have been divided into two categories: more developed regions and less developed regions, and then the analysis is from UN publication dated 2013. The first panel talks about the more developed regions, the second panel talks about the less developed regions. As regards the policies to address adolescent fertility, several policies and programs have been initiated by various governments, and then these policies and programs to address adolescent fertility usually focus on supporting public facilities as well as non-governmental organizations that are working with young people, whether they are in school or out of school. That means the government, public health facilities, and the non-governmental organizations that are working with youth irrespective of their schooling status, and then who are training the youth in life skills, and then they are providing appropriate information and education on reproductive and sexual health to the youth. And then let us have a look at the kind of policy and program initiatives that are in place to address the adolescent fertility. These include innovative educational approaches, peer counseling for the youth, orientation for the parents, strengthening education on reproductive and sexual health, in a non-formal setting, vocational training programs and youth clubs. Several of these initiatives were supported by United Nations Population Fund. Let us look at figure 4. This figure gives the percentage of governments considering level of adolescent fertility as a major concern, categorized by level of development, and then the chart gives us trend from 1996 to 2013. If we take all the countries, the percentage of governments considering the level of adolescent fertility as a major concern increased from 46% to 67% during the reference period. In case of more developed regions, the increase was from 27% to 40%. On the other hand, in the less developed and least developed countries, there has been substantial increase in the proportion of governments that considered adolescent fertility in their country as a major concern. It increased from around 53% to 76% in case of less developed regions, and in case of the least developed countries, it increased from 48% to 88%. We have to keep one point in mind here while analyzing this chart, that the policy response and the perception of the national government depends by and large on the current fertility trend. In this case, the current fertility levels of the adolescents. The level of adolescent fertility prevailing in a country determines the policy response of the national government. So, the chart has to be analyzed keeping this in mind. Now, let us move to table 3. It talks about government's level of concern about adolescent fertility from 1996 to 2013, whether it was a major concern or a minor concern or not at all a concern. For the world as a whole, the percentage of countries considering current level of adolescent fertility as a major concern increases from 46 to 67%, and only 8% of the countries considered the adolescent fertility as not a concern at all in 2013. In case of more developed regions, 40% of the countries considered adolescent fertility as a major concern, 42% as a minor concern, while 19% considered it as not a concern at all. In case of less developed and least developed countries, 76 and 88% of the countries respectively considered adolescent fertility level to be a major concern. Table 4 gives the response of the governments with regard to adolescent fertility by various regions of the world. In case of Africa, 80% of the countries in 2013 considered adolescent fertility as a major concern. In only 2% of the countries, it was not a concern. In Asia, 56% of the countries felt that adolescent fertility is a major concern. In Europe, the percentage is small with 40%, and Latin America and Caribbean, all the countries considered it as a major concern. And then governments with policies to reduce adolescent fertility from 1996 to 2013, the results indicate that across the world 60% of the countries were having policies to reduce adolescent fertility in 1996, and it went up to 90% by 2013. In case of more developed regions, the percentage of countries having policies to reduce adolescent fertility moved from 52% to 77%. In case of less developed, the increase was from 63 to 94%, and in case of least developed countries, 60% was the figure for 1996 and it reached 100% by 2013. Table 6 gives the analysis similar to table 5, but for the different regions of the country of the world. Let us now summarize about the discussion we had so far in this module, and then what kind of learnings we had from the discussion. The global fertility declined, but the fertility levels and trends vary widely across the regions as well as countries. Replacement fertility was achieved in many of the countries, and in response to the changes in the levels and trends of fertility, various governments, or in fact almost all the governments, initiated measures either to raise the fertility level or to reduce the fertility level. In the more developed regions, family friendly policies aimed at raising fertility levels were adopted. The more developed regions have adopted family friendly policies so as to enhance the fertility levels, and significant change has been there in the policy response of the governments post ICPD 1994, in line with the recommendations provided by ICPD. In view of the implications of adolescent fertility or early childbearing, many governments have initiated policy measures to reduce the adolescent fertility, and many of these governments also expressed their concern about the adolescent fertility levels prevailing in their country. Fertility levels vary across the regions and the countries. This is a concern. The more developed regions have more and more initiatives to enhance the fertility level. On the other hand, the countries and the governments from less developed region and least developed countries have more and more initiatives and policy interventions to reduce the fertility level. Thank you so much.